My name is Chilambwe Mwila, implementation scientist at the Center for Infectious Diseases Research in Zambia, CIDES. Today, I will be sharing with you some work we've done concerning substance use and HIV outcomes for formerly incarcerated people in Zambia, which is a cohort study. So just some background. So overall, we know that we are doing better at getting incarcerated people living with HIV on treatment, but we really don't know what happens to them once they're released back into the community. And so in the study, we're trying to understand whether they still stay in care and some of the reasons why they may be falling out of care. So some context, and this is taken from the Global World Prisons Report. We see that our prisons have a high HIV prevalence, and a substantial proportion of our incarcerated persons are actually on remand, still awaiting trial. So in terms of HIV and incarcerated people, we know that incarcerated people face a disproportionately high HIV prevalence, and this is due to several different factors. And there's evidence to show that they can start ART while detained within the prison settings and be able to achieve good clinical outcomes. However, these clinical outcomes are often not sustained, and this is because there's poor HIV care continuity in the community. So we see there's been studies in the past that have shown that it is very possible to achieve good clinical outcomes, particularly viral load suppression, while incarcerated people are detained. A particular study that looked at universal test and treat in Zambian and South African correctional facilities shows that in Lusaka, we see 95% of the proportion of participants achieving viral load suppression at 6 months, 6 months of detention. So our objectives and aims, overall, we are aiming to elucidate how alcohol and drug use disorders, as well as other social demographic and health behavior and health systems faced by an affected post-discharge retention and care and longitudinal HIV clinical outcomes for releasees. Specific aims, we are aiming to describe releasee viral load suppression and community follow-up in Zambia. And secondly, we're trying to examine the association between post-release substance use and viral load suppression to identify actionable targets for an HIV transitional care pilot. So looking at our methods, we worked in 5 correctional facilities in Lusaka province, correctional facility, Mambeshi correctional facility, Lusaka Central, Chainama, and Kamwala Remand Prison. Our participant selection included prospectively enrolling incarcerated people in those 5 correctional facilities who were above 18 years of age, had a documented HIV infection, were due to be released within 30 days from the screening day, and were also enrolled in the HIV treatment program. It was also essential that the participants were willing and able to provide voluntary informed consent, as well as locator information that will enable us to locate them in the community. So specific enrollment and follow-up procedures we did is, so all study participants were recruited, screened, and enrolled before they were released into the community. And at baseline, which is just before release, within 30 days of release, we had study procedures which included viral load testing, collection of clinical, social demographic, and psychosocial information. We had one follow-up study visit at approximately 6 months after release. And this required contacting participants in the community and meeting them at a mutually agreed safe space to be able to complete the same procedures that we did at baseline and have them done at follow-up. So in terms of analysis, we described summary statistics for variables of interest, and we also estimated the association between post-release substance use and viral load suppression while controlling for confounders. And we did this using the Cox proportion hazard model. So in terms of results, we from March 2017 to December 2018, we screened 396 incarcerated people and enrolled 75% of those who met eligibility criteria. And then of the ones that were enrolled, 90% received ART for at least 30 days and were included in the analysis. And then of those included in the analysis, mostly were young men with median age of about 35 years. And then at baseline, we had sort of a midline CD4 count of about 39 cells per cubic millimeters, and viral load suppression was seen in 88% of our participants. Some preliminary findings. So again, we really focused on individuals who had been on ART for at least 30 days before release. And so they would have sort of benefited from ART while in the corrections facilities or corrections environment. And so of the 201 participants that completed both viral load and substance abuse screening at median time of 7.3 months, we see 7% of them having reported interval hazardous alcohol and or drug use. And we use the WHO validated tools to assess for alcohol and drug disorders, commonly known as the audit and DEDIT tests. The viral load suppression proportion reduced slightly to 84% at follow-up. And we also see that releases generally with that were found with hazardous alcohol and or drug use were 3.5 times more likely to have unsuppressed viral load post-release in the community compared to those that didn't have these conditions. This is just a table to show some of the other characteristics of interest that we were looking at and trying to see if there was an association with unsuppressed viral load at post-release, that is. And we see that generally women were at an increased risk of having a loss of viral load suppression whilst in the community. And also people who had a low CD4 count at baseline were also about 3.8 times more likely to lose the viral load suppression post-release. And this kind of makes sense because these individuals were likely sicker and more immunosuppressed at baseline. And then I think the biggest take home is that, again, those with alcohol or drug use disorders were 3.5 times more likely to lose viral load suppression once released from prison. So conclusions, the key findings and recommendations that we have was that firstly, there's a numerical decrease in the proportion of justice involved people living with HIV with viral load suppression after release. And then there's hazardous alcohol and or drug use was significantly associated with unsuppressed viral load in the community. This points to the new transitional HIV care models that are urgently needed to support HIV care engagement and address comorbid substance use in this key population. Special thanks to our study participants, colleagues from the Zambia Correctional Service and Ministry of Health, as well as the study team pictured in this slide.